What's the cause of a habit? Fetus sometimes sucks fingers, so it satisfies a nutritional and emotional need. After the nutritional needs met, still have an emotional need to suck fingers. As a nutritional and emotional need, after the nutritional needs met, still have an emotional need to suck fingers. Etiology of habit, you have a psychoanalytical, here's a new word, a psychoanalytical or meaningful habit, which we talked about. There's an emotional problem present, or we have this empty habit, which is a behaviorist type of habit. It's learned and there's no neurosis. What's a good example of this? How do you know when a child comes in there's some meaningful psychological or emotional problem present versus this silly, stupid, learned with no neurosis habit? I think back to a time I spent in a pediatric office off Main Street, Main and Union area in Williamsville. And this girl and boy, brother and sister came in holding hands. That's okay. Mom and dad were holding hands also, which with each other and with them. That's okay too. But guess what? They were all, I swear to God, they were all carrying teddy bears. Something wasn't right about this picture. You won't maybe ever see a scenario like this again, but the point is that something is very odd, something is very strange about what I'm seeing here. In that case, I probably wouldn't mess around with the kid. I'd rather, if you have this, once in a maybe 10-year event, send the patient to a pediatric dentist. Again, the meaningful habits, fortunately, are rather rare. The empty habits are what we're dealing with most of the time. So, looking at ages 6 to 12, if you have a meaningful habit, there may be a more severe emotional problem present that you probably shouldn't want to deal with regarding habit appliances. An empty habit, you discuss the habit, but you don't punish, certainly. 6 to 12, though, is when you want to deal with habits. You don't really want to deal with habits too much on a 4-year-old. You might use words saying, "Oh, Johnny, Mary, you're getting so big now, you probably don't want to suck your thumb anymore. Probably a good time to stop. Do you think? Should you start thinking about that?" Yeah, I want to stop. I'm gonna work on it. I'm not making a fixed orthodontic habit-breaking appliance on a 4-year-old. 6 to 12, the kids can rationalize. They can understand this better. They can help you, be your ally, and want to quit. The behaviorist approach, sucking fingers satisfies a food intake relationship. They're hungry, which is a type of frustration maybe. There's thumb sucking. The habit occurs with other frustrations. You suppress the habit. There's no psychological sequelae. Habit rarely recurs. That's Johnny, who is going to his PhD program in immunology. Management of habit, you have to respect both views. Before 6 years old, severe damage is rare and the child isn't able to rationalize. You want to direct your attention, as I said previously, also to the 6 to 12-year-old. There's no psychological damage with a removable appliance, but if the child wants to quit, fixed habit appliance is best. So, you're the treating dentist, somebody comes to you asking for perhaps a habit appliance. I'm not really giving out a removable appliance. The child really needs something more than that. So you give them a removable. Remember, there's a fee being charged for this. I want to put my money on a fixed appliance. as most predictable. You get from point A to point B the quickest if the child wants to quit. You can talk about reminder appliances that are sort of removable, maybe tying a string and yarn around the thumb, fixed versus removable, again, to be consistent with the mini text. The removable, if there's a need to suck thumb, but that's not really high on my list for reasons I already mentioned. You praise and reward progress. You continue the habit appliance for 3 months after the habit ceases. In the orthodontic world, appliances are done for months, not I put in the appliance, it's done, the habit is quit, in a month I'm taking out the appliance. No, you want to keep it in longer. Removable habit appliances, something like this, a good reminder appliance. Also, something like this, tongue rakes, as we call them, other kind of fixed habit appliances. In these two cases, actually, we're doing a rapid palatal expansion appliance that you learned about in Dr. Falsafi's last lecture, and there's a rake in front that will separate. So you're expanding at the same time you have a reminder in there. Here, there's a little bead on the appliance. With a thumb crib, they're really very effective. Half the patients will stop immediately, 85-90% stop within a month, but again, you leave it in place for 3 to 6 months after the habit stops. Again,